Project CB visited Midvale Private Hospital. We wanted to find out more about this World Patient Safety Day. Welcome to Project CB, and I am here at Midvale Private Hospital with Sister Marisa. But you know what? World Patient Safety Day, it's high on the agenda for today. But not only just for today, for time to come as well. But let's hear from Sister Marisa what she's got to say about World Patient Safety Day.
Good day. Welcome to all of you here with me today. Yes, as you say, it's high on the agenda, and it's today the first day that we're celebrating the Patient Safety Day worldwide. And this is after one of our patients in Joburg was in a motor vehicle accident in 2004. And she sustained quite a few injuries, and she was quite sick till around 2013. She lost the eye, and this is one of her biggest injuries what that happened. And then after that, she realized that there's a big gap for patient safety. You know, the doctors talk to each other, and the multidisciplinary team talk to each other, but they talk over the patient, they don't talk to the patient. And there was a lot of questions left in her own nursing regime that she was asking. So she started driving the whole patient safety thing. So, and then it went over to World Health Organization. So today is the first International World Patient Safety Day. We're celebrating it also here in Midvale. As you can see, we have the sticker for the patients. All the patients received the sticker, and also a wrist brace to say they must remember patient safety. The colors is blue and orange. So yes, we focus on all the areas, and we also trying to get buy-in from our patients. We can improve our patient safety for the future. So yes,
It's a very important day right here at Midvale Private Hospital, and there's a bin. Can we quickly get a bin as well? A shot there at the back. There's a bin that the patients they put in and say, yeah, this is what you should do, what you should not do. And it's quite important to see and sustain where the hospital is at currently, so that you can improve worldwide as well. So what is the message from your side to the people out there?
you know, it's a small thing. It's like, you know that we as nurses and doctors feel the patient's supposed to know, but they don't also always know it. Like the big drive is also with hand wash. It's a thing going forward. And, you know, patient care afterwards, wound care, when to go back to doctor if there's problems, to take your medication, and, you know, if your doctor is not available, where to go to if your doctor is not available. So, yeah, and we, like you said, from the bin, there's a whole questionnaire that we did give out for our patients to come with ideas.
It's quite important that the patients right here at Midvale Private Hospital knows exactly their future, what will happen if the hospital put everything into place. They will be friendlier and happier, and importantly, they will be more safe as well. So a quick summary of today.
The big thing is actually we just want to make the patients aware that we do care for their safety, and to get the message out there that the patient count, because the patient is the most important thing. We're not there for them, they are here for us, because if we don't have patients, We don't have a job and we don't have a hospital, and that's the whole drive to keep our patients safe.
Safety, safety, and you've guessed safety. So that's what and how we are driving today with World Patient Safety Day. And there's another sister that we are going to get a little bit her story. I think she's got a first-hand experience concerning this World Patient Safety Day. So let's go and meet her. Well, we've got Zona Maria right here, right next to me, and she's working at Midvale Private Hospital, but she's got a story to tell. And this story is different from the rest. So, welcome to Project CB.
Hi, appreciate you.
So, tell us your story. Give us, in brief, what happened, and tell us what could have been better, because we are here at the we are celebrating World Patient Safety Day, and we need to know these things.
Okay. I decided to go for a hysterectomy in 2011. That was a different experience, a traumatic experience. What I thought was going to be a general procedure, where I go home after 2 or 3 days, became my worst nightmare. I was admitted on Friday the 13th in May 2011. The last thing I remembered was when I was pushed into theatre, and after that I can't really remember anything. Only after a week later, I woke up in ICU. At first, I didn't know where I were. I found myself lying naked in an isolated room under a white sheet, and I couldn't move because my hands were tied to the bed. There was a pipe in my throat. There was a pipe in the side of my body, draining my lungs. There was a strange object on my stomach, and I thought I was having a nightmare. So after that, the unit manager, Sister Ala, she came to me and she explained to me what happened, that there were complications after my hysterectomy, and that I had a severe case of septicemia. And yes, I was going through great trauma. My whole body was burning. I was in so much pain. I was on a ventilator for, I think, about a week. They put me under an induced coma. I saw my family coming and going and crying, and I thought I was dying. I was actually having an out-of-body experience where I looked down from the ceiling onto my body, and I told myself, Zona, just get back into that body because your son still needs you and you have to fight this. My body was swollen, my hands, my feet, and in that time I met 2 wonderful nurses. Beverly was taking care of me during the day, and then Gillian during the night. And after that, they became my friends because they supported me, they nursed me, they encouraged me. And yes, a few times the nurses, Sister Ala, called my family to come and say goodbye because they thought I wasn't going to survive this. But I kept on fighting, and I got the best care ever in this hospital. And 3 weeks later, I was transferred from ICU to Ward 1, where I was taken care of for another 2 weeks. I was discharged then. They sent me home to recover for about 4 or 5 weeks. I had a colostomy bag on my stomach because I learned that I had a punctured lung after the hysterectomy, and the doctor accidentally cut my intestines. So luckily they could reverse the colostomy. So at end of July I was admitted again, and they reversed the colostomy bag, and then about end of August I was discharged again. So I was about 5 months from work. Luckily my boss at that time, he kept my post, so I resumed my work in October. And it took me about 2 years to recover completely. I still have problems, medical problems at times, but yes, I got my life back thanks to the great nursing staff that we have in this hospital, their commitment, their professionality. I can only tell good things about them. And they are my best friends, those two ladies in ICU, because they supported me. They read me books, they read me newspapers, they held my hand, they encouraged me. And yes, so I'm a survivor.
That is Zona Maria, that's a survivor from a procedure that should have been easy, quick, and recovered in more or less a week's time. Took her almost 2 years to recover. And that is why the World Patient Safety Day is so important, because a simple procedure can be simple, but if if there is a possibility that someone somewhere didn't do exactly what they should, you end up 2 years later with a story to tell. But we are so excited that Zona, you've recovered and you've made new friends. And the most important aspect of your story is that you have first-hand experience and what it is to be safe in a hospital.
Yes, for sure.
So thank you so much, Zona, for your story.
Good morning. My name is Hetty. I work at Midvale Private Hospital. I do client services for the hospital, and that is why World Patient Safety Day project ended up on my desk. So for today, we have planned quite a few exciting things. I think Sister Marisa already spoke about them, but just in case you don't know, we are all wearing orange bracelets. The department, the Director General for Health asked the whole country working in the health industry to wear orange ribbons today. We decided to go with bracelets. We are also wearing stickers that says World Patient Safety Day with the logo and Midvale Hospital. We made our passage blue with these beautiful blue lights so that you can see the colors for spreading awareness of the project. I also have a revolving screen at the back that shows the project and what it is about. I have Carlet Badenhorst from Project CV, who came to the hospital to do interviews with staff, doctors, nurses, patients, anyone that wanted to speak to us. We even had dietitians, the physiotherapist, anyone that was available to talk to us about patient safety, they did. And Carlet, thank you very much for spending the day with us. We really, really appreciate your input on today.
Well, I'm here at the Midvale Private Hospital right here in Vereniging, and it's the very first time ever that we are celebrating and holding World Patient Safety Day, okay? And it's affiliated with the World Health Organization. And right here with me, I've got Sister Sandra. So, good morning.
Good morning, Corlette. It's so nice to meet you.
Come a little bit
And
in.
it's
There
the
we go.
first time we're holding it, but I think we score a total of 10 out of 10 for this because we really love our job. We really are enthusiastic to give the best patient care available. So at the moment, I feel that it's a good thing that you started this World Patient Safety Day, but our thing is to give the best care always. So I think we do not have a necessity for this actually today, but we love doing this, and we've got the full risk assessment next to our patients' beds. We've got all the emergency trolleys forever because it's a high risk ward. It's a heart cardiothoracic ward. We need this emergency trolley and oxygen all the time. We need it here. And at the bedsides, we've got the emergency bags that gets checked twice daily. The emergency trolley gets checked twice daily. Our patients are happy. They mark with a full risk, and they are also identified, properly identified daily. We make sure that it's daily done. And maybe you can ask the patient some questions, because I don't think we have a problem.
So this is Leah from the Midville Private Hospital, and we are celebrating World Patient Safety Day. Okay, so tell us a little bit more about this World Patient Safety Day.
Can I hold the microphone?
You can hold the mic.
Thank you. It's a very a good privilege to talk about patient safety because it's important, and this includes everyone who works in the hospital, including the cleaners, because they also clean the floor. The floor could be slippery. Therefore, it is very important for them to understand about the safety of a patient. It doesn't just go with the nurses or the doctors and so on.
Well, finally, we've got Andre here, and a warm welcome to you, Andre.
Thank you.
So what do you do here at Midville Private Hospital?
Okay, I'm a physiotherapist for Chantal Habig Physiotherapy, and I've been working here for a few months now.
So you're a newbie on the force.
I am.
That's awesome. So what do you think about World Patient Safety Day?
I think it's actually very important as for awareness as well, because as being a young physiotherapist, I've not only been exposed to different hospitals, especially early in my career now. I've been exposed to different hospitals, and when you sort of compare the safety of how the health professionals treat their patients, it makes a big difference in the patient's recovery for whatever treatment they are receiving, mentally and physically, whether it's a surgery or if it's just for medication to treat the simplest of conditions. And for a physiotherapist, we sort of step in also along this path to recovery. So it's not that safety is the only thing, but it's definitely one of the most important things, especially for treating a patient.
So that's it. Thank you so much, Andre. Now we know exactly from a physiotherapist as well what he thinks about World Patient Safety Day.
Thank you.
Thank you.
Goeiemôre, my naam is Hetty. Ek doen kliëntediens vir Midville Hospitaal. Ek is hier vandag saam met meneer Fischer. Dis deel van ons World Patient Safety Day projek. En meneer Fischer is nou net terug van sy fisio af by Andre. En ek wil net vandag vir hom vertel waaroor ons projek gaan. Môre meneer.
Môre.
Ek baie welkom by Midville Hospitaal en dankie dat meneer bereid is om met ons te praat oor die projek. Eerstens wil ek net vir meneer sê, ons projek gaan oor pasiëntveiligheid. Wat kan ons doen of wat doen ons reg en wat doen ons verkeerd in terme van die versekering dat ons pasiënte veilig is, dat ons nie u blootstel aan onnodige risiko's, goeders wat prevent kan word, byvoorbeeld as 'n pasiënt 'n high fall risk is, dat ons nie meneer onnodiglik blootstel aan byvoorbeeld val en sulke tipe goed nie. So in daai gees het ons hierdie armbandjies wat ons vir al ons pasiënte gee vandag. En dis die kleure van die tema oranje en blou. So ek gee hom so lank vir meneer en dan dra ons hierdie plakkertjies. Kan ek hom maar vir meneer opsit? soos hy. En dan het ek so 'n klein vraelysie saamgestel. As meneer hom asseblief my sal voltooi voor meneer ontslaan word, net om vir ons te vertel wat meneer dink van ons patient safety. Maar terwyl ek by meneer is, hoe voel meneer in Midval Hospitaal?
Baie gelukkig. My verblyf na die operasie in die intensive care unit was absoluut fantasties. Hulle diens is regtig uitstekend. Jy weet, as jy gaan vir fisio, daar's teen alle tye 2 mense wat saam met jou stap. Dit is verskriklik seer as jy moet eers begin loop. En ja, maar na 'n week of so raak dit bietjie beter. En een persoon kan jou daarom hanteer. Ek moet sê, na ek oorgeplaas is na hierdie afdeling toe, die susters wil ook nie hê jy moet alleen stap nie. Nie in die begin in enige geval.
Ek is baie bly om dit te hoor. Voel meneer veilig by ons?
Ja.
Okay. Okay, meneer voel nie blootgestel aan enige risiko's wat moontlik kan veroorsaak dat meneer seer kry of infeksie optel of enigstens iets as gevolg van ons. Baie dankie meneer, ek waardeer dit. Meneer moet 'n lekker dag verder hê. En ek wens vir meneer spoedige herstel toe.
So I'm here with Dr. Goldtwine, and welcome to Project CB.
Thank you so much.
So what can you tell us about today?
Well, it's World Patient Safety Day, and I think that world patient safety begins at home. So all the old age home patients who share their medications with each other, that needs to stop. All of those things need to be communicated. Patients need to come to hospitals with their medications. They need to follow up with their doctors with their medications that they're using. And I think that will enhance their own safety significantly if they manage to do that correctly and if we can educate people to do that correctly.
So help me out quickly. I don't know anything about medication at all. I've been at a hospital just for my birth, and I think tonsils or something, that's it. Now, let's say I'm a new patient coming to Midval. How would you go about with me?
So first you'd be admitted and you'd be seen by the sisters or the admission nurses who would bring a whole set of papers along for you to fill in and for you to declare what medications you're on. Okay, so the biggest problem that we have with patients is the hidden sleeping pill in the pocket or the hidden sleeping pill in the drawer or the grandpa sachets when they arrive with upper GIT bleeds or bleeding from their stomachs, and then they're using grandpas, which exacerbate this problem, and they hide them away in their drawers. So these are things that need to be addressed from the patient's side that will improve their own safety and will improve our ability to keep them safe and our ability to make them well again and improve their health.
So that's short and sweet. So thank you so much, Doctor, for briefing us on the fact that we need to start at home to be safe. And then when we come to the hospital, it's easier for you guys as well.
Excellent. Thank you so much.
Thank you. This is Cornelia Park, and she is a dietitian. And welcome to Project CB.
Thank you very much. It's a great privilege.
So I've seen that you've been with a patient.
Yes, that's correct. This patient actually went through a procedure, and now it's very important that we, after the procedure is done, that we also guide the patient to follow the correct eating habits and the correct type of foods. Otherwise, the whole procedure is actually not worth it, because the aftercare is very important. So it doesn't help we spend all the time and all the money, and the procedure is done, and because what we eat is going right through our body and the digestive system, so we are part of the medical team, because it's very important that this patient know, otherwise the operation there will be complications. And he must also adapt to it in his new lifestyle, that we can have like a permanent solution and not like for 6 weeks I'm doing that. So we had to guide the patient to what to do after operation and procedure and what to actually on the end focus on for the rest of his life. But very important, he's an individual, and therefore it's not like here's a list, this is black and this is white, and this is yes and this is no.
So Cordelia, let's talk about World Patient Safety Day in the light of what you are doing.
Okay. On the end, it is very important that we must understand a person is somebody with a very, very sensitive body. So think about safety as well. I always use the example of a motor car. If we do have a little squeak or where there's a little light coming on, we immediately stop and we give attention. But what we do with our bodies is we actually neglect it. So it's not about being sick or in hospital. So I think in general, it is very important in general that safety is important for our body, to protect our body also from harmful incidents and also situations. Also what we eat is very important, safety ways, because you must be educated, or we may have to, I think that's me as a dietitian, it's my responsibility to educate people what's safe for the body and what not. Because there's a lot of harmful substances that we do take, and again, depending on what your situation is. So I think food is part of safety.
So Cordelia, when I eat, I become that in the sense of what if I eat a lot of chocolates or a lot of caffeine, that becomes part of me, and that's not always good for my body.
Yes. I think what we also need to realize is the more simple we can keep it, the better. We must all realize that our body needs 3 major type of nutrients. We call it macronutrients. You need protein, you need carbohydrate, you need fats. That is like you need oil, you need water, and you need fuel in your car. Then we've got micronutrients, which is our vitamins and minerals, antioxidants, and that's what we find out in mostly our colors, which is fruit and vegetables. But there's nothing wrong to by occasion enjoy a piece of cake or having a chocolate, but a chocolate is not your lunch. And I think that's where we have to. And in certain conditions, depending on my diagnosis, some substances can be unsafe for my body. For instance, if I've got an allergy, I cannot say, I feel like, let's say you've got a milk allergy, I'm going to drink some milk, I feel like it's only once. If your body can't tolerate it, it can be your death sentence. But it's not to say nobody can have milk. So I think we mustn't say to having a chocolate or a biscuit or a coffee now and again, but you can't say, but that's my diet. We always say you are what you eat. So also, your diet is what you put in your mouth. So all of us are on a diet.
So thank you so much, Cordelia Park, for your insight into you are what you eat, or you eat what you are, however that one needs to go about. And thank you so much for your time right here on Project CB, and thank you for the insight concerning the World Patient Safety Day and what you eat, what you put in your body.
Thank you very much. I think we've got a big responsibility to the public.
So that's how it is with us right here on Project CB, and you've heard it from the horse's mouth. What you eat is who you will become.
I'm Yolandi Fenter. I'm a mother of 3. My little girl of 5 years old was bitten by a dog on Friday evening, a boerboel. Unfortunately, she went to rub the dog, and I think he's a bit old, and he didn't like it very much, and he decided to grab her, and unfortunately it was in the face. So yeah, she was in theatre for 2 hours. It was a dramatic time for us, but we threw it all, and the doctor, Dr. van der Merwe, did a wonderful job. And now she's recovering just 100%.
Maybe we can find the little one. She's just on this side as well. But you know what? Being in the hospital, having these traumatic events, and how did the Midville help you guys?
Well, I must say, from previous experience and from this last few days, I was so overwhelmed because from the first doctor or from the first nurse to the last doctor, they were open-handed and they helped us with every single thing, even with emotional feelings that we had to go through. I mean, the doctor even grabbed me and hugged me and said, "Mama, don't worry, she'll be fine. And she's going to make sure that everything is okay." And every single person in here, I must say, I'm overwhelmed. And I must say thank you to every single one that's been so friendly and helpful with everything that they've done for us.
We're still in the pediatric room with Sister Ronald Dreyer. Now, we're talking about the World Patient Safety Day, and there's a lot of care when it comes to our children. So, Sister Ronald, give us a brief on our child and let's say child safety for now.
Okay, I'll start with, according to law, the door must be locked, so the children are not allowed to go out. If they go out, they must be identified with 2 white bands, and they must go out with a parent. They're not allowed to go out without it, and with a nurse. And with a nurse accompanying them to wherever they are going. So they're not allowed to take the child out without our permission. The other thing is, if a child has visitors, if they have visitors, they are not allowed to bring children under 12 years in the ward, and that's because of infection control, so that they can't bring bacteria or anything in, and the child can't give it to them.
Kan jy dit glo? Ons staan reg hier in die teater en dit lyk amazing. So as jy 'n pasiënt is, dit is hoe dit lyk. Ek dink jy sien jouself net, of hulle, die susters sien jou net hier, maar dit is die omgewing. Maar ek het 'n suster Susan Engelbrecht ook hier saam met my. So welkom by Project CB.
Môre Carlet, baie dankie. Ons praat oor Wêreldveiligheidsdag vandag en hier by Midvale in die hospitaal, soos by enige ander hospitaal, is die veiligheid van die pasiënte baie baie belangrik. Eerste ding wat ons doen as ons 'n pasiënt bestel van die saal af, kom daar 'n geregistreerde verpleegkundige saam met die portier met die pasiënt tot by ontvangs. Dan word die pasiënt geïdentifiseer, hulle bandjies aan. Is die pasiënt allergies vir iets? Is dit die regte pasiënt vir die regte dokter? Vra dan vir die pasiënt watter kant gaan ons opereer? Is jy meneer of mevrou so en so? En die pasiënte moet dan reageer daarop. As daar dan nou die pasiënt reeds 'n pre-med gehad het en daar is familielede by, kan hulle dit ook bevestig. Baie van die geneesheere verkies dit om die ledemate te merk wat ons gaan opereer, en dan is dit ook vir ons makliker om dan te sien, jy weet dat ons nie so goue fout maak nie. Baie pasiënte voel, ons bly vra, môre mevrou, watter kant gaan ons opereer, maar dit is die belangrikste deel van die saak, dat die pasiënt kan bevestig, ek kom vir my linkerbeen of my linkerarm of vir 'n laparotomie. En dan ook moet ons kyk na die veiligheid van die pasiënt op die bed. Kan die bed op en af, want die pasiënt moet getransfer word of oorgelaai word. Is die kotkante, werk die kotkante as die pasiënt na die tyd wakker word en hulle is onrustig dat hulle nie afval nie. So, en as ons dan die pasiënt instoot, bevestig ons dan met die toestemming wat die pasiënt geteken het, gewoonlik voor die tyd voordat hulle 'n pre-med gekry het, om te sê dat ek toestemming gee om hierdie operasie op my te doen. En hulle skryf dan ook in hulle eie woord woorde om te sê ek kom vir hierdie soort operasie sodat hulle weet, hulle verstaan waarvoor hulle dan kom. As ons die patiënt instoot, is daar 4 of 5 mense om die bed wat die patiënt dan laat oortel. Die narkotiseer is verantwoordelik vir die bokant van die patiënt se kop en bene, vir die kop, en weerskante staan daar dan 2 persone wat die patiënt gaan oorlaai en iemand op die voet. Dan staan ons by die patiënt totdat die pasiënt slaap. Dokter sê dan vir hom, ons vra weer, bevestig weer watter kant gaan ons opereer, en dan staan ons by die pasiënt totdat hy aan die slaap is en geïntubeer is. So die patiënt is nooit regtig alleen nie. Die narkotiseer bly die hele tyd by hom. Hy het 'n narkose suster wat hom ondersteun en help met alles. Jy weet, sit vir hom 'n bloeddrukband aan, suurstofmonitor en so aan. En dan as die operasie verby is, gebeur dieselfde ding. Jy weet, die narkotiseer is verantwoordelik om 'n oop lugweg te hou, die pasiënt se kop vas te hou en te transfer iemand by die voete, weerskante van die bed, sorg dat die briek vas is, die vloere moet droog wees sodat ons nie gly en val nie. En dan vergesel die skropsuster en die narkotiseer die pasiënt tot 'n herstelkamer en ons bly by die pasiënt totdat die pasiënt wakker is en die narkotiseer is tevrede sodat die pasiënt kan terug gaan saal toe. In die saal is daar iemand, gewoonlik kom daar 'n geregistreerde verpleegkundige om die pasiënt te kom haal, en in die saal word die pasiënt dan weer eens gekoppel op 'n monitor wat sy bloeddruk en sy pols en daai goeters vitale data vir hulle monitor. Totdat die pasiënt heeltemal wakker is of nie wakker is nie, hou ons hulle kotkante of hulle kante op sodat die pasiënt dan nie van die bed afval nie, en ons reël dan ook dat jy weet, as hulle vitale data gedoen het en die pasiënt wil opstaan om die kante te laat sak, vir hulle 'n trappie te gee en hulle te vergesel om dan vir die eerste keer badkamer toe te gaan en so, en dan word al hierdie goeders moet genoteer word, wat belangrik is vir inligting na die tyd, en dit is belangrik om te sien, is die pasiënt se bloeddruk reg, is sy bloedsuiker reg, is sy temperatuur reg, is daar enige bloeding, en as daar enige een van daardie dinge nie in plek is nie, om dan die geneesheer in kennis te stel.
Ek is so dankbaar, Susan, want ek het altyd gedink, ek kom in by die teater en die dokter sny net, en nou hoor ek daarom, ek was altyd bang, my regterarm moet gedoen word, dan doen hulle my linkerbeen of iets in daai lyn, so ek is dankbaar, ons het daarom, daar is systeme in plek vir dit, ook, en dit is die veiligheid van die pasiënt in die teater as sulks ook.
Pasiënte moet net altyd onthou, jy weet, hulle kom in teater in en dan is jy die skropsuster wat nou vir die 5de keer vra, mevrou, watter kant gaan ons opereer, maar dit is net vir die pasiënt se veiligheid. As jy in 'n besige setup is en daar is 2 mevroue de Bruin, maar 2 verskillende dokters, sê dit nie noodwendig dat ek die regte mevrou de Bruin weet het nie. So jy moet sê, hoorie, so as ek vir jou vra, is jy dokter so en so se pasiënt en ons gaan dit doen. Wees maar geduldig met die suster of met die verpleegster wat dit vir jou vra, want dit gaan oor jou veiligheid. Ons kan iemand se arm afsit en dan het ons die verkeerde mens beet. So as jy nie kan sê jy's allergies vir dit en ek is op hierdie soort medikasie en jy gaan daai arm van my opereer nie, dan is ons almal in gevaar om jy weet, groot skade te ly. So wees geduldig met die personeel wat vir jou 10 keer vra. Sy weet jy is mevrou so en jy kom vir so en so operasie, maar as jy mevrou de Bruin van die 3de de Bruin op 'n lys in die oggend is, weet, kan daar 'n fout inkom. So wees geduldig, sê ek is mevrou de Bruin van dokter so en hulle gaan dit en dit aan my doen.
So het jy dit nou gehoor. Hulle kan nie 'n fout maak nie. Dankie Susan vir jou insaag in vandag ook. Ek is verlig dat jy soveel keer vra vir die regterarm of been en nou weet ons, daar sal nie foute insluip met dit ook nie. So baie dankie vir jou tyd. Baie dankie dat jy saam met my op Project CB is.
Baie dankie vir die geleentheid en veilige pasiëntsorg daar buite. Dankie.
Dankie. Go for it. So we're still in the cat lab, and I've got a doctor here with me, Dr. Crosby. Welcome to Project CB.
Thank you.
So tell us a little bit, what do you do?
Okay, so I'm the ENT specialist for Midvale Hospital. I've been here for 2 years, or almost 2 years, and building up my practice and really enjoying working with the community. Midvale has been a great community set up, and it has been one of the nicest hospitals I've worked in.
So you've got it. It's one of the nicest ones, Dr. Crosby says.
From a professional point of view.
From a professional point of view. Now, doctor, concerning World Patient and Safety, and we in that process of that the patient needs to be safe in the environment. So, quickly brief us on what's your perspective of that.
I think, it's quite an open question. I think one of the things is to treat every patient like an individual. Yes, we do our training. We're all properly trained. We've all done our registrar. We're all specialists. We've all learned the textbooks and know what the textbooks say. But when you're actually out in the working world, you don't treat people like textbooks. Every single person is an individual, and every single person needs to be treated as an individual. No one diagnosis fits everyone, no one treatment plan fits everyone, and it's to take people as people, I think.
It's important to treat people as people, Dr. Crosby says, but out of a safety perspective, like, what if you don't treat people as people? What would happen then?
I think the trap that one can fall into is that you learn protocols, you learn algorithms, and we learn a disease diagnosis, and we apply that to a disease, and quite often the person doesn't exactly fit the protocol, and you have to adjust, you have to be constantly thinking, and I think the most important thing is to listen to your patient. A patient in 90% of the time will tell you what their problem is. You as a doctor have to sit and be prepared to sit and listen. The patient won't be able to give you a name to their problem, but they will be able to tell you what their problem is, and you just have to listen.
So most of the time, a doctor needs to listen. If you don't get a doctor that is a good listener, I think you will have quite some problems.
Exactly. Yeah.
So that's Dr. Crosby for you. Thank you so much, Doctor, for your time. I know that you've got a hectic schedule still waiting, so may you just do what you do best and go and save some people.
Thank you. Okay.
So for World Patient Safety Day, we've got Sister Hannetjie van Deventer right here, and she's going to talk a little bit out of her perspective what this is all about for her.
Well, patient safety is not just about getting the patient in the bed, getting the right diagnosis, treating the patient accordingly, and, to what the doctor prescribed. It's also about how we act around the patient. If we go near the patient, it's, for example, hand hygiene. That's very important. So if I don't care for myself, if I'm not clean, if I don't make sure that my hands are clean when I touch the patient, then I can contribute to his illness, maybe give him more infections. So there's so many things that we have to look for. It's to give the correct medication, the correct dosage, to be the spokesperson between the patient and the doctor, to be the advocate, as we learned in college. So it's so vast. I cannot just explain it in one sentence.
So, Sister Hannetjie, you in the surgical department. So, let's look according to the surgical aspect and Patient World Safety Day.
Okay, especially for surgical, we have to prepare the patient properly. So we are part of the Best Care Always campaign, where we must prepare the patient, use the correct shaving equipment to make sure that the skin is intact, to give the patient proper soap to wash with, so that we make sure that there's no Staphylococcus aureus on the skin. We have to make sure that when the patient goes to theatre, we don't expose him to cold temperatures for too long, because the hypothermia is contributing to sepsis. When the patient comes back and he's got a wound, we must make sure that we treat the wound accordingly. Also, we give antibiotics prophylactically, and then also, 3 dosages mostly after surgery. So there's a lot of things that we have to make sure that's in place to make sure that our surgical patients are safe.
So that's from us right here on the surgical ward as well, with with Sister Annetjie van Deventer as well. So thank you so much, Sister, for your time.
It's a pleasure.
So right with me, I've got Mr. van Niekerk. Sir, I know that you are here at Midville, and tell us a little bit about your experience here.
Oh, it's been quite a good experience. I've been admitted yesterday at a hernia operation, and I must say the procedures that was taken was very nice, and they looked after me very well. And yeah, I came out of it day after, and I'm feeling very well. Yeah.
So you look good as well. So now, I know as well that you're coming from a paramedic side of viewpoint as well. You are a paramedic in management post. So tell us a little bit about the World Patient Safety Day, and out of that perspective.
Okay, basically, I'm not a full-blown paramedic. I'm an ILS provider. Yeah, in our mission, the side I'm coming from, we are very focused on women and child death. So response times is very important to us for the 15-minute turnaround for P1s, and also getting mother and child to a facility where they are safe, where the baby can be delivered and looked after very well, and also survival, to bring survival up in that way.
And I assume that there's quite a lot of pregnant mothers out there that really needs 15 minutes to get to the hospital.
Yeah, for sure. Even if you look at the complications that you can pick up with breech babies, with hypertensive-induced pregnancies, and all of those things. So it's very important to get a patient rapidly to the nearest, closest facility that can assist them.
Let's talk about safety out of that perspective as well, because having a pregnant mother being in labor, and it becomes a little bit messy at times. So how would it be on that side of the fence, saying, okay, this is mother, this is child, we need to not be reckless concerning them? How would you guys go about?
Yeah, basically we stabilize on scene if the baby is on its way. If it's not, then we transport safely to the hospital. And safety is always first in our profession. Always look for safety of yourself and safety of the patient first. And we've also got specialized units on the road currently, obstetric units that are fully equipped and capable of managing those type of patients. And then ALS paramedics to back up them if there might be a emergency where there's a breech baby, or epileptic-induced pregnancy, or whatever the case might be, to stabilize the patients and get them to a facility as soon as possible.
You've heard it from Sir van Niekerk. And thank you so much for your time as well. And I hope that your recovery will be extremely quick as well.
Thank you very much.
Thank you, sir.